My research interests focus on children with externalizing behavior difficulties. And when I say externalizing behavior, I'm really referring to acting out behaviors like hyperactivity, aggression, defiance, any behavior really that can lead to negative interactions between a child and their environment. And under that broad category, I would organize my research into three areas. The first area is really trying to understand the experiences of kids with externalizing behaviors in the school setting. And within that, I would say I focus more on kids specifically with attention deficit hyperactivity disorder, or ADHD. And I've been trying to figure out what their experiences are like at school in terms of academics, as well as in terms of their interaction with peers. So for example, we know that kids with ADHD tend to run into difficulties getting along with their peers. But I want to know a little bit more about what that looks like in the school setting. Like, is that in all interactions with peers, or is it more problematic in interactions with peers around completing academic work? Or does it also pertain to, just playing with peers on the playground at more unstructured times? My second area of research is related to developing and understanding malleable intervention targets for kids with ADHD or kids with externalizing behavior in the school. So with this area, I've really focused lately on understanding the relationship between ADHD symptoms and academic enabling behaviors. So academic enabling behaviors are things like a student's academic engagement in the classroom. How much do they raise their hand and pay attention to what the teacher is saying? The second area is academic motivation, so their motivation to engage and be successful at academic tasks. And then the last area is their relationships with their teacher and their peer specific to academic assignments or tasks in the classroom. So I really am trying to figure out if maybe those academic enabling behaviors are one of the key reasons why kids with ADHD tend to not do as well academically. And my hope is that I can use that information that I find from that relationship between ADHD symptoms, academic enabling behaviors, and academic achievement to ultimately develop some interventions that could be used with parents or with teachers to help them support kids who are just starting school. So what can we teach parents to do that would help them interact with their child in such a way that once the child came to school, they would be more likely to be engaged in the classroom or to be motivated to learn. And I'd really like to do that focused on kindergarten students, so we can really start at the very beginning of their school experiences. I teach a course called Psychological Interventions with Children and Their Families, and the course is focused on the concepts and techniques related to providing therapy interventions. So we start the semester by talking about some of kind of the big issues related to the provision of therapy, like does it work, should we do it? And then we move into really understanding the theories that guide the specific techniques that we choose. And from there we move to talking about both the general or common kind of factors related to therapy, like building a relationship, to the more specific components, like what are some of the manualized interventions that exist to address internalizing problems like anxiety or depression, as well as interventions to address conduct problems. So we will look at some of the evidence-based manuals for delivering interventions that are out there, and we'll actually role play some of the techniques that get used in them. So for example, one technique might be to teach parents how to deliver effective instruction. So in class we'll role play that and take a look at what that would exactly look like for somebody to do in a therapy session. In addition, we have several other assignments really meant to deepen understanding, like conducting a literature review on an evidence-based intervention of the student's interests. So they could pick one that focuses on trauma or grief or different areas that really interest them. And then the students will also actually be engaged in a case study at their practicum site. So they'll be working with a student, developing rapport and delivering an intervention designed to address, either anxiety or depression or other types of concerns that they might have in the school. The other class that I teach is Consultation, and Consultation is really a key skill for school psychologists in developing collaborative relationships with teachers, with parents, to really help students be successful. In that class, we'll learn skills associated with consultation, and then we'll have an opportunity to really practice those skills, first with other students in the class and through videos and feedback on those videos, and ultimately we will have an opportunity to work with a case in our practicum sites where we can work with a teacher and practice those consultation skills in a sort of a real life setting. One key theme that runs across both research and teaching is that students really play a key part of our program, and so we're excited to welcome students who share similar interests and who might be interested in becoming school psychologists.